medical problem. Keep your eyes and ears open and see if you can figure out the solution to each mystery. Today, we're in the general medicine clinic, and our first patient is a 55-year-old woman. She's made an appointment to see you. You're her physician. You start by introducing yourself. Then you say, "What can I do for you today?" Your patient answers, "I never feel good." These grand round sessions are a traditional part of every medical education. Each one is an in-depth discussion of a patient case, from initial presentation to diagnosis to treatment. We'll gather our history. That's the story, the reason the patient came in. Then we'll perform a physical exam and develop what's called a differential diagnosis of what might be going on. If needed, we'll order tests to confirm our suspicions. Then we'll come up with a plan to help the patient. So, what should you expect to learn from these cases? You'll certainly see a wide variety of symptoms and diseases, and you'll get a good appreciation for how the body works in health and in disease. More importantly, though, by the end of this series, you'll have a much better understanding of how doctors think, how doctors figure out what's wrong with a patient, how we use our skills to rule in or rule out certain diagnoses, how we come up with a diagnosis and a treatment plan, and how we work with patients to improve health and prevent and treat disease. Obviously, I'm not your physician, and I can't give you personal medical advice. That's what your own doctor is for. But by listening to these lectures, you will learn how to communicate more effectively with your doctor. Understanding what doctors do and how and why they do it will make you a better patient and will improve your own health. Our Grand Rounds case today is the 55-year-old woman we've just met who says she never feels good. In medical encounters, doctors start every case with the patient's age and gender, followed by the so-called chief complaint. This is a quote, usually in the patient's own words, of what the main concern is. Why did this person come to see the doctor? It's a very important piece of information because it focuses the evaluation on what the patient is worried about. Sometimes, chief complaints don't end up being the main thing that the doctor is worried about and don't directly point to the final diagnosis, but it's still something crucial to know when you're getting started. In this case, our chief complaint, it's vague. I never feel good. It doesn't really help us narrow down anything, but it does tell us that our patient is suffering and always feels bad in some way, and maybe has been for a long time. There could be a clue there. After the chief complaint, we'll take a history of the present illness, often abbreviated as an HPI. This is a story, the patient's story, of what's going on, when it started, what sorts of factors influence the symptoms. When we take an HPI, it's important to let the patient do most of the talking. We'll give a bit of a lead or a push now and then with questions to clarify the story, but this is the time for the patient to tell us what's going on, not the other way around. Our patient says that she used to be healthy and vigorous and used to enjoy playing tennis. About 5 years ago, she began to find that her energy wasn't as good. At about the same time, she broke her wrist and had to stop playing. She wonders now if maybe stopping tennis was a mistake. At the time, the doctor who treated her broken wrist thought that her bones didn't look strong on an X-ray, so she was referred to a specialist and eventually started on calcium supplements and hormone pills, often used in postmenopausal women to increase bone density. She recalls that those medicines, there were a series of different medicines, actually, they caused a lot of stomach symptoms, and she ended up stopping them after a year. She was also supposed to take iron because she was told she was anemic, but ended up thinking that the iron made her stomach feel worse, so she stopped that too. Still, even after stopping these medications, she's continued to have intermittent belly aches and constipation and sometimes diarrhea at times, and she often feels bloated and nauseous. She recalls that she wanted to stop drinking milk. She had read that lactose intolerance could cause some of her symptoms,